this session is part of 3 different Global Climate and Health Alliance series that are ongoing at the moment. So the slides might look a different format if you've been to others in the series. But this is part of the GCHA Climate and Health pilot course, and you can find more information about that on the website in English and in Spanish. Or by searching for hashtag GCHA course on X. It's part of a course on engaging policymakers on climate and health. It's the second in that series, and also the fourth in the SB60 Health Community Prep series. This call is being recorded, so hopefully it's a useful resource to refer back to. And in case you haven't realized yet, it is possible to listen to simultaneous interpretation in your preferred language. I am already guilty of doing this, but if we could ask people to speak slowly and clearly to enable the interpreter, Andrea, to do her job as well as she always does, it would be fantastic. Thank you so much to Andrea. And do type any questions in the chat. Thank you for already introducing yourselves. So we'll actually begin today with a panel discussion. We're going to hear from Martin Muchangi from AMREF, from Sophie Tepp from the Centre for Planetary Health Policy, and from Osva Polo from CAN Latin America Working Group on NDCs and Ambition. We'll think through after that if other people have learnings or questions that they want to share and what an agenda flow for a meeting could look like, especially in the UNFCCC context. But hopefully knowing that this is also directly before WHA, but the World Health Assembly, that it will also be useful for people who are heading to Geneva. Following that, we will talk through how to use the GCHA Healthy NDC scorecard. We won't spend too long on that because I think some people are already familiar with it. We'll run through how to find out your country's position on different issues, and then climate and health evidence in your country, where some useful places might be to look and see what the current status of things is. Without further ado, I will hand over to Milena, who will walk us through this panel discussion, which we are really looking forward to. And I will stop sharing screen at this point so that you can see our wonderful panelists. Thank you.
Thank you, Jess. Welcome, everyone. My name is Milena Sergeva, and I'm the liaison officer for Latin America and the Caribbean for the Global Climate and Health Alliance, and I'm happy to present this amazing panel. We hope to be given great tips and knowledge on how to relate with the government and how to advocate on climate and health. So I'm going to present Dr. Martin Muchangi, who is the Director for Population Health and Environment and AMREF Health Africa. Then we have Sophie Gebb. She's a research associate at the Center for Planetary Health Policy, which is an independent think tank in Berlin, Germany. And we also are expecting Osver Polo. He's a member of the CAN Latin America Working Group, and he'll be joining the call. But in the meantime, let's start discussing with Martin and Sophie, and let's jump straight into today's topic. If you have an unexpected chance to approach a policymaker during a larger meeting for the first time, how do you introduce yourself, and how do you introduce your work, and how to start the conversation?
Yes, hi everyone, and thank you for inviting me, and I'm very much looking forward to the discussion. So I think it really depends on the context, but often what happens is if you're at a bigger meeting, you saw the person speak or give an intervention, And then they have some few minutes after where you can go there. And I would maybe encourage you to think about like 1 or 2 sentences to present yourself and 1 or 2 sentences to present your organization in an understandable way. So for example, for me, the Center for Planetary Health Policy is not an organization that many people know because it's like we're quite new. And planetary health is also a concept that is not very known to many policymakers, especially in the climate field. And so what I would do is I would present very shortly, like in 1 or 2 sentences, what the center does. So in our case, it's we give scientific policy advice at the nexus of health and environmental sustainability or climate change, and on health policy within planetary boundaries. But I would also tailor it a bit to what I think the policymaker is working on. And then I think if it's possible to relate to something they said before, that's really great. But other than that, you can just try to find either a common topic that you relate to, for example, in this sense, climate policy, but probably more narrowly, what exactly is this person working on mitigation, on adaptation, on loss and damage? How does health relate to that? Or to a specific process that is currently happening. So for example, if your country is doing an adaptation strategy, you could talk about health in that adaptation strategy. And I think what would be good to kind of have in mind is a bit, what is your role? So are you approaching them as a policy expert, as a health expert, as an activist, or are you giving scientific policy advice like we are doing? Or are you a scientist even? So what is your role a bit, and what is their role? So are they a legislator? Are they in the ministry? What kind of power do they have, or what kind of role do they have? And then also, what is your goal? And I think, of course, the long-term goal is policy change for a healthy future. But what is maybe the short-term goal can be much more simple, like that you just meet and maybe you want to meet again. So oftentimes when you, for the first time, approach somebody, maybe the goal is not to convince them on the spot to do something very different, but to just start to establish a relationship that you then can build on later on. So I hope that helps.
Thank you, Sophie. Martin, would you like to contribute? Thank you, Martin. And about the beginning of the introduction, you mentioned like an image of responsibility, of accountability. Do you have like an opening line? How do you introduce yourself? How do you introduce your work? Sophie already answered this question, but I would like to see your viewpoint. Martin, you said that it would be good to picture or imagine a good. Do you have a special way to introduce yourself? How do you introduce your work? Do you have an opening line? Thank you, Martin. And Sophie, how do you get ready for a formal conversation with the government. Maybe you can contribute with some of your ideas?
Yes, thanks a lot. So I think it really depends if it's kind of an appointment or a spontaneous meeting that you meet someone on an event. But maybe just to look into, imagine you sent an email to a negotiator or a policymaker, and they gave you an appointment. And I think in that case, it's important to prepare yourself not only content-wise, which I think a lot of you are quite experts in, the climate and health content, but also regarding the role of the policymakers and the current context, the political context and the processes. So what do I mean with that? I think it's a very different meeting if you meet someone, for example, in the German parliament, where their role is passing laws and having a legislative function, compared to if you meet someone from the ministry who is working very differently on policy processes and on very different way of working. So kind of doing your homework before that, who am I talking to? What is their role in government or in legislative branches? What is there maybe also their power? What can they do? Which processes are they currently working on? And what does health have to do with these processes? And then also thinking about what is, like, maybe, as Martin already said, what are the partners, who's already maybe working with them, who could I check in before to understand what they would be most interested about, or maybe who could I also join up with for a meeting. And then, of course, prepare content-wise, but also be open for maybe questions that come from the side of the policymakers. You don't have to be an expert in everything. It might be very detailed questions, but then maybe feel confident to say, oh, that's a really good question. I don't know the answer right now. I can get back to you with answers. I know people who will have the answers because most of you are very connected in networks on climate and health. And then also, as I said before, not every meeting will lead to either a direct policy change, but maybe try to establish some regularity in the meetings. I will get a bit to that later on. You can feel free to bring some kind of info materials, things that GCHA have been doing, things that your organization has been doing, maybe even papers if you feel like they're relevant. So you can leave them with things. You don't have to have a full presentation, but you can also leave them. So for example, I would bring, if I recently wrote a policy brief, I would bring it to a meeting. Yes, maybe this is some things to think through. So think about content, but also about how does it fit in the whole policy process? Where are you at? Is it the beginning of a government's mandate and they have a lot of years, or is it the end and you would think, what would you like to see before government might change? So also what is the political context, I think is quite important. Yes.
Amazing. Thank you very much. You mentioned recommendations that sometimes we want to transmit to decision makers. Let's imagine we are in an international meeting, a negotiation meeting. How could we adapt a recommendation that we want to make, like from the health sector, a recommendation of our organization, for example? How can you adapt it based on the interest or the context of that decision maker that we approach, right? So that person can actually understand and add our recommendation to their argument. Sophie, please, since you started talking about recommendations.
Yes, so I think what we have to realize, first of all, we are for example, a lot of us come from a health background, and if we start talking to climate policymakers, we might have to switch a bit the language, and we might have to do some homework to understand what they care about. And then, so I think a lot of us are engaging with policy processes when they're happening, but they have been preparing for these for months and maybe even all year round. And so I think this is important to keep in mind. So even if we have great recommendations, the decisions on what governments will decide on, or the lines between which they move during a negotiation might already have been taken quite some while ago back at home. So while that doesn't mean you cannot give recommendations, and they might even like fly because there's a window of opportunity that suddenly comes up for adding text or for pushing for more ambition, I think don't be disappointed when, even though you tailored it well, you reached your audience, it might not be taken on this time, but you might get to speak with them again and to prepare between, for example, COPs or between WHAs. So most of the policy work done is actually done between the big meetings. And in terms of tailoring, I think understanding as well as you possibly can where health could fit in their process without, how do you say, like a little puzzle piece, and not so to understand where it could fit in is the best. And I think that's where also GCHA's work has been really, really valuable, like finding together possible points of entries that then can be raised with governments. And so depending on how tight the timing is, you might be able to speak a bit bigger about health and climate change, but sometimes you might just be very specific about indicators or about one certain wording, or about maybe even something that doesn't have the word health on it, but is very important for climate ambition, and therefore you can just add your argument as a health professional or as a health researcher. So I hope that answered your question.
Yes, thank you very much.
It's difficult for Martin because he's traveling. So if you can ask in Spanish, I will type in English.
So same question I presented to Sophie. In your experience, Dr. Martin, how have you like adopted or adjusted a recommendation so it fits in the context of the meeting with that person, so they can use your recommendation in their negotiation?
And Martin, if I can repeat the question in English for you. So the question is, now, if you want to make a particular ask to a policymaker, how do you frame it in a way that is going to resonate well with them because you know their background and their priorities? Is there an example that you can give of this? Thank you.
Thank you, Martin. And Sophie, how do you get ready for meetings?
So usually, I think about what, like I look up, as Martin said, current processes, current positions. I maybe ask. Sometimes I also ask international climate advocate allies or researchers, what do you think I should take to the meeting? Because I think sometimes it's good to ask to see where other people are at, or I talk to other climate researchers in Germany. And then I think, what can I bring to them? And maybe sometimes I also map a bit in my head what are upcoming windows of opportunities or events that I would want to talk to, where we could talk about. So thinking about what's currently going on, where might they have questions, where do I see opportunities for raising ambition on climate and health policy, which is maybe current evidence. So for example, if just the Lancet Counter just published a data sheet or a policy brief on your country, that's a great resource to take. So maybe what's out there and that supports your argument, what did you maybe write yourself, and bring that to the meeting. You can also ask them what their interest is. So you don't have to, if you ask for a meeting yourself, of course you can have an agenda, but you can also listen to a bit what would be their priorities are. Do they have any questions? And as I said, if it comes up spontaneously and you don't know, feel free to very honestly say, this is something I will research and get back to you. So maybe on that, research a bit where we are in the political context, but also, as Martin said, what is current evidence that you can bring? What are questions that may come up? And it helps to sometimes have like a little bit of a map of the year in your mind. So when does what happen? When are elections? When are international meetings that you want to talk with them about the position of Germany, for example, things like this. Have this in mind, because yeah, these are kind of little windows of opportunities that you can at least hook a bit to and talk about what you think should happen there.
Thank you very much. Now I'm going to ask Dr. Martin in English. Sophie, would you like to add something about your strategy and how you approach a negotiator, a climate negotiator, or someone from the health ministry, for example?
Yes, thank you. Dr. Martin already raised very important points, so I will just add to that, but agree with everything that has been said. I think different sectors have different logics, different processes, and different language. So the way which language and which terminology I use might also change quite a bit. And so for all of those working at the intersection, you have kind of knowledge on both sides, maybe even leaning towards one side. But I think the second you engage with policymakers that are working more strongly on one side, the level of detail about how much on which detail you speak changes. So if I talk to a climate climate negotiator or climate policymaker, I will have to go way more into detail on what is current climate policy and how health fits in. But the health part might be actually quite basic because I might not have to go into details so much. If they ask, I can. And on the other way around, so for example, when we, for example, talk to global health policymakers in Germany, probably the overview of what I give of what happened at COP will be quite rough, and we can go into detail, and I am also prepared to go into detail, but I think going into very, very detailed knowledge on how specific negotiations went at COP might be overwhelming and too much. And so for the start, you would give a broad overview. You would maybe even go a step back and explain what COP is, what the role of COP is, because you can't assume that policymakers are as deep in both policy processes and spaces as you are. So I think bear that in mind, in a respectful way, you might have to just take a step back and explain again, what is COP, what is the relevance, who's actually deciding what at COP, and why does that matter for health, for example. And then you can also build on, and as Martin said, already happen policy processes that are already kind of trying to bridge the barriers between sectors in Germany, and maybe jump on that wagon to say like, oh, this is now happening, this is a cross-sectoral policy, and I think you should engage for that reason. And how is your contact with the Ministry of and maybe kind of work a bit what is already there, what is already breaking down the barriers. But I think don't underestimate how strong, as also Martin underlined really, really well, how strong people are working within their sectors, and then that you might have to take a step back and start a bit with more general messaging on the sectors that they're not super in-depth involved in.
Thank you, Sophie. We have here with us Osber Polo Carrasco. He is from CAN Latin America on NDCs and ambition. Nice to see you, Osber. We're happy to have you. You come from the climate movement and the health community that works on an ambitious way, and we are hearing lots of your organization. So thank you for joining and sharing your experience here with us. I have several questions for you that I'll present now because our health experts already answered. They advocate on international meetings on climate, but what do you do? Like if you have an unexpected opportunity to approach for the first time to a policymaker in a bigger meeting or an international meeting, how do you introduce yourself? How do you introduce your work? And what do you do if you have the chance to prepare yourself for a formal meeting? So good morning. I'm talking here from Lima, Peru. I'm Osber Polo Carrasco. I'm the coordinator and responsible for the CAN Latin American group. An example, now that we are close to the intersectional meetings in Bonn, first we get ready by holding a series of debates, revision of the COP28, the Conference of the Parties, and we touch upon topics that are of concern for our network. And we organize a series of debates with specialists, with experts, to understand the takeaways of the COP and what did the negotiators propose. We take the official documents, we read them through point by point with lots of detail, and we take the most important points, the most concerning points, and we try to formulate our debate based on those. And also uh, we prepare a document, we elaborate a document with that we call a starting document to elaborate on some points. For example, the ambitions of the NDCs. We also work on adaptation. So we elaborate a list of recommendations, those lines that we thought didn't have enough progress in the text, and then we organize the bilateral before these big events. And for that, we coordinate with our partners, national and international partners, and we put together like an agenda. But before that, we prepare the document. And then we prepare the program, the agenda, the points that we want to touch, the questions about our document, and what observations do they have to contribute facing this meeting. But we also ask, what's your most important work and what's your international viewpoint on this meeting? This is just like to share information, to set some ground, what are their expectations, and the topics, how this topic reinforce their national policies. You know, it's a conversation to understand the local and also the international area. This document is like a base, a reference for the conversation, because this week, for example, we have a bilateral with Peru, and we 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 work in also in a block of countries like the Lilac, for example. So in these meetings, what we want is to continue that discussion. We want to build a relationship because the negotiators are working on the day-to-day basis, following the topic. We do the same. We follow everything the country does on the areas of concern, and we also go and find out the results of the negotiations. We look for papers so they understand that the recommendations that we make have scientific sustain. But from the regional and international perspective, after that dialogue, we also organize like an agreement to continue the discussion, the conversation in the same space we were given of the negotiations. And then it's a little bit different because as we've been building that communication, that relationship, we talk in different meetings to see how our recommendations are progressing. And we put that information on the table. But it's also very important after these meetings, we do like a follow-up work, a regional follow-up, an international follow-up work. Once these conversations are over, this we carry on with these relationships. We don't have to let them die, right? We need to continue with that building. Maybe someone didn't make enough progress on the proposals that we put on paper, and then we organize workshops to keep on discussing those topics. Maybe if they have more reasoning behind, they can understand why we think that topic is important, why we think that proposal is important. And maybe they start thinking on this in the national, but also with an international perspective. That's why we also have workshops on specific topics. We always are aware or try to detect the things that didn't progress enough. So we move them forward, and then these focals also make the effort of working nationally or national follow-up. That's very important. And that's why we also reinforce and organize workshops for the locals so they can push the topic in the national tables they participate in their own. For example, in Peru, we have the Climate Change Commission, and that's the space for someone to see if they are taking the recommendations into account, or if the topics are progressing as expected. Thank you, Osber. To conclude the panel, each of you, would you like to share an advice to anyone? Would you give, what kind of advice would you give for someone who would like to start advocating or collaborating more in a more efficient way with the governments? Sophie, then Martin, and then Osber. And with this, we would conclude the panel.
Yeah, I think my advice would be to try to do whatever you do, activism, advocacy, scientific policy advice all year long, to build this relationship with partners together. Because I think sometimes policy can seem, for me, I can sometimes compare it with an avocado, like it's for a long time, it's not ripe. And then there's a very short moment where it's really good, and then it's over, then it's not good anymore. And this is a bit for me like policy making, like you really have to find that sweet spot where your advice or your recommendations or what you asked from can be actually incorporated. And to be there at that moment, you have to watch the avocado quite closely for a longer period of time together with other partners. So my recommendation would be to have a relationship, to see it as a year-long process, and then to then swoop in or be there with your recommendations when the avocado is good, kind of.
I loved the avocado. Any advice, Martin? A final advice for someone who would like to start collaborating more efficiently? Osber, any final tip you would like to share? Well, you have to know your negotiator. You need to know if that person is open to conversations, for example, or how interested that person is on the topic, so you can actually build these relationships. What we do at the beginning of every year is to go through all of the negotiators and what they have done. We reach them out and to discuss with them their viewpoints, and we make a match like with our proposals and the work they've been doing. So we try to find commonalities. And something that's very important, we do not wait for the pre-COP meetings. We start building these relationships much earlier. And something that is very important, you need to always be aware or being aware of the national politics, because we may demand many things or include many things in the proposal, but they are not concerned about that, or they haven't included in their agenda. So we try to to understand what kind of obstacles can we run into, to assess the effort, and how can we help them as civil society to reinforce some elements, like with workshops, with skill building, or delving deeper in a specific topic. We try to be a contribution to them, and that way we earn their trust. We learn from them. How can we improve our dialogues, our conversations, our proposals, always working together with our members and theirs. And sometimes they invite us to speak in an event, the other way around, and that way we build a relationship, so we listen to each other, demands and proposals. We need to use social networks a lot, because each recommendation point that we want to communicate is like a flag. You know, you need to be aware of X point in this negotiation point, or you can also congratulate the negotiator for having a conversation, for raising a topic. We do that constantly. You have to get to know to the negotiator really well, and so you can improve and build these relationships. That will help you a lot on the work. Thank you very much, Dr. Martin, Sophie. These were very interesting reflections based on your experience. We know in the call there are others with experience in advocacy in international climate events. So if you have a question, a comment, or any of the other experts, if you want to share like a brief tip in the chat, welcome. So you can post your questions or tips in the chat box so we can share them with everyone. So thank you all.
Thank you to the wonderful panel. Thank you, Milena. Thank you to everyone. And Milena, I think just to make it easy for people to follow the links in the next part, if you could post the link to the slides in the chat, and then if anyone needs to leave early, then they have those. If anyone needs to leave on time, I think we will finish a little late. then you will have those links, and we will share the recording, of course, as usual. For the remaining points, I will talk through now how to use the NDC scorecard that GCHA has produced. I won't spend too long on this because I know it's already familiar to many people, but you can see the links to the different iterations here on this slide. And just to explain one example, this is from the 2023 Healthy NDC scorecard. So you can see that we rank countries according to how they include health in their nationally determined contributions, their plans to deliver the Paris Agreement. And we look at 6 categories. So integrated governance is whether or not the health ministry was involved in preparing the NDC. Any health impacts of climate change that are mentioned in the NDC, whether those might be quantified, for example. Whether there is action taken in the health sector on mitigation or adaptation, whether there are recognized health co-benefits from action in other sectors, again for mitigation or for adaptation, but that might be healthy sustainable diets or active transport systems or clean air or access to clean water from resilient water and sanitation. Economics and finance is whether there is a costing or a budget that's associated with any of those actions, or whether there are returns on investment that have been calculated. And then monitoring and implementation. Are there targets? Are there follow-up actions? How is this all planned? And if a country has scored well in the NDC scorecard ranking, then often we find that it is possible to speak with them and to use it as a nice conversation starter on how well they have included health in their NDC, and from there to ask what the process was at national level for doing that, what the rationale was, what their personal opinion is, and just to use it as an entry point. For information to find information on your country's policies or on their positions, you can use departmental websites and the media. That, of course, is a really useful way to find your own national sources about what's going on in your country. But I will talk through some of the UNFCCC related tools now. So you can visit the UNFCCC submission portal, which I will just show you now because it is not the most straightforward to navigate. But for example, if you wanted to look at submissions on adaptation, there is a process at the moment to look at indicators. There are a lot of results for adaptation. I'll just show you adaptation to start with. So you can really see that there is a lot to scroll through. And if you're interested specifically in the global goal on adaptation, the process at the moment is very focused on indicators. So you can narrow it down and you just get the global goal on adaptation process. You can click to see what Bolivia, on behalf of LMDCs, wrote about the global goal on adaptation indicator process. You can walk through their submission. You can do a Control F for health, and you can see that they do not mention health. But as the next stage after that, what it's useful to be able to do is to look at how the wider content compares to the COP28 health community priorities. As an example, we will of course be updating these for Bonn. You can look at your country's NDC on the UNFCCC NDC registry. I'd love to issue a warning to everyone that the NDC registry is incredibly slow if you're trying to sort it in some way. So if you experience that, then it is absolutely not a problem that is unique to you. If you are patient, it will eventually refresh the page and show you what you are hoping to get to, but it's possible to read your country's NDC in that way. You can also look up your country's long-term low emission development strategy or the national adaptation plan, or adaptation communications. All of those links are also on the page. I also really recommend WRI's NDC enhancement tracker. the World Resources Institute, and they show how one NDC compares to the previous NDC, whether or not it's been improved on, whether there are areas that are weaker. So that's a really valuable tool on the climate side. If you'd like to sign up to more regular health and UNFCCC policy updates, if you're not already on that email list, then you can do it by filling in the form that is on this slide. A little bit more on where there might be useful information. You can look at whether or not your country has endorsed the COP28 declaration on climate and health. And you can also look and see whether they submitted an annex to that declaration. There are now 150 countries that have endorsed the climate and health declaration. Mozambique is the one that is not listed on the list that's on the COP28 website, I believe. But that should be updated soon. There's the Alliance for Transformative Action on Climate and Health attached. If you follow that link, you can see which countries have signed up to mitigate or adapt in the health sector and their timelines for doing it. And there's a great map there as well. And you can filter by different targets and commitments. I think the other options might already be more familiar to people and they are quite easy to navigate, so I'll skip forward. For evidence on climate and health in your country, again, so valuable to look at national resources first and foremost, and because we are the Global Climate and Health Alliance, a lot of our knowledge is in international resources, so please always do look for national resources first. But just to commend to you the Lancet Climate and Health Data Platform, and I saw Camille was on the call earlier, so I hope I don't mess this up too badly, but there is national tracking for a lot of the indicators that are available. So if we look at change in labour capacity, you can click through for all of the different indicators and see what the situation is like in your country, and the sort of graph varies depending on which indicator you are looking at. There are the UNFCCC Health and Climate, WHO, UNFCCC Health and Climate country profiles, and there's for many countries now available on that page. The biennial transparency reports, there's only a few so far, but there should be a lot more by the end of the year. And these are where countries support and report on the implementation of their NDCs, as an example, and also on their emissions reductions, how that's going. And then also wanted to commend again another WRI, World Resources Institute resource, these country profiles. So if you scroll down to country profiles on the page, you could select, let's go for Cambodia. And you can see how Cambodia compares to other countries around the world, if it eventually loads, which it might not do. Hopefully it will come shortly. But there is also an option where you can see what the emissions are from different sectors, which sectors are really driving emissions, what the targets are, how emissions compare to different countries, which sectors have an adaptation plan, as an example, and you can see that health does appear in there. I'll stop there, and I'm sorry that the loading wasn't working as well as it should have been. But it's an incredibly valuable resource, and while it's not health specific, there's a lot of health relevant information in there. And I think that brings us finally to the end of today's discussion, and I'm very sorry that we ran a little way over. And as usual, there will be a recording. Thank you so much, everyone, for your time today. And looking forward to seeing you on the next calls. Thank you.